Providing health care to new immigrants and refugees can be difficult when there are language barriers. However, a local doctor has launched a project to address these challenges in BC's family practice offices. About 200 GPs in New Westminster, Coquitlam, Port Coquitlam, and Port Moody will have access to free telephone interpreters. It's the first initiative of its kind in Canada. And Patricia Gabriel is the doctor behind the initiative and joins us here in Studio 10 this morning. Good morning, doctor.
Good morning.
Tell us about this project. How's it going to work?
So when a patient comes in and has limited English proficiency, right now we have to rely on our best attempts at English or a family member or friend who may be available to interpret. Sometimes this works very well. Sometimes there's obvious concerns. Now a physician can pick up the phone and call a professional medical interpreter who can facilitate the conversation over the phone.
Why did you want to do this? Why did you want to highlight this particular issue in family medicine?
I opened my practice in Coquitlam about 3 years ago, and it's a very multicultural community with a lot of immigrants and refugees, and I quickly realized that I couldn't communicate directly with many of my patients. Language is very important to providing health care, and I wanted to be able to understand exactly what my patient was saying to me, and I saw this as a potential solution.
Before this, what was missing in the existing interpretation services available?
So if you're seen at a hospital or some community healthcare centers, there's already access to professional medical interpreters. But in the average family doctor's office, we don't have access to this service. So we have to rely on informal interpreters.
How common is this?
In BC, particularly in the Greater Vancouver area, they estimate about 20% of the population speak a language other than English at home. And some doctors have multiple languages as well, but we don't have a population of healthcare providers that matches our diverse population. So I believe it's very common.
It's difficult for the doctors, but it's equally as difficult, even more difficult perhaps for the patients. In fact, some new immigrants may not search out a doctor because they know that they're going to run into this barrier. So how do you get the word out now that this is available?
It's a very good point, and we know that a lot of patients don't seek health care. And in Canada, patients with limited English proficiency do have poorer health outcomes. So at this point, this is a pilot project for our community, and we'd like to show that this is feasible and helpful. After this, we'll need to seek more sustainable funding, and hopefully it's a service that can spread province-wide.
Since you brought up the F-word funding, how's it being paid for?
So we have over the past few years, local divisions of family doctors have been established. In my area, it's called the Fraser Northwest Division, which is New West, Port Moody, Port Coquitlam, and Coquitlam, and they've agreed to fund the pilot project.
What's it like to practice medicine and to deal with a patient when you have to use a third person in the conversation? Because the conversation, taking the history, is sometimes the most important part of any diagnosis.
Absolutely, and I've found in the past when I don't have an interpreter, I can be very misled. I may be addressing a simple case of acid reflux, but if something's lost in translation, I may not be certain and feel the need to order additional investigations to rule out stomach cancer. If I have access to a good interpreter, I can get the nuances of the history and make a more accurate diagnosis.
What happens next with this project?
Over the next 3 months, we'll be rolling it out to physicians in our community and evaluating the project. If we can show that it's something that's feasible and helpful, then I hope to try and extend it to other areas of the province.
How's it working so far?
We go live this month, so we'll have to wait and see.
But it's all in place?
It's all in place.
Is the word out there to patients now as well, that they can come and see Dr. Gabriel and there are interpretation services available?
Well, personally, I've actually been using interpretation services for the past 2.5 years in my practice because it was something that was important to me, but I believe I'm the only family doctor who regularly uses this service. On Tuesday night, the project was announced to the members of our division. In terms of patients, this is the first that people may know about it. So if anybody lives in our community, they can now ask their family physician if this service can be made available to them.
And it is available to all the physicians, the general practitioners in your area?
Any physician who's a member of the division, which is most of the physicians in our community, practicing in a community setting, such as a fee-for-service clinic or a walk-in clinic, which is most of our primary care in the community.
Well, Patricia, thanks for coming, and best of luck with this.
Thank you.
Patricia Gabriel, family doctor who practices in Coquitlam. It is now 13 minutes before 7 o'clock, and Amy's back with an update on traffic.